Present.
Joyce Beer,
Present.
James Jennings,
Here.
Anna Marshall,
Present.
Lucian Harris.
Present.
We have 5 present, 0 absent.
5 present, 0 absent, constitutes a quorum. All business conducted will be official. The next item on the agenda will be the approval of minutes, February 12, 2020.
So moved with any corrections.
Representative Marshall made a motion to approve the minutes with any corrections. Second by Representative Deere. Discussion. Discussion. Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Beer,
Yes.
James Jennings.
Yes.
We have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda will be the order of business, TR 20-040, a tribal resolution of the Muskogee Creek Nation authorizing the principal chief to execute a request for use of school property with Beggs Public Schools, sponsors Ann Marshall.
A motion for due pass.
Representative Marshall made a motion for a due pass. Second. Second by Representative Jennings. Discussion. Representative Marshall.
Nancy is here.
Hi. So we had
Good afternoon, Ms.
previously, good afternoon, how are you? We previously requested, this for Henrietta Schools. They've had some difficulties with their gym, so we can't use that facility. Beggs is the next option for us. Also then again, we'll be looking at the health situation to see if we can actually carry out that event. This will have it in place for us, and we're able to use for celebration, or reschedule it for later in the year possibly.
Question, Ms. Mason. Thank you, Ms. Mason.
Thank you.
Roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Beer,
Yes.
James Jennings.
Yes.
We have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. TR 20-041, a tribal resolution of the Muskogee Creek Nation authorizing principal chief to execute and submit the request for license to the state of Oklahoma Department of Human Services for the nation's child care centers, sponsors Representative Marshall.
A motion to due pass.
Motion for due pass by Representative Marshall.
Second.
Second by Representative Deere. Discussion. Representative Marshall.
I believe.
We have, Becky Higgins here in child care.
No, we have to have this agreement in order for DHS to have someone to contact if there are any problems at any child care centers. As it is right now, if there's a complaint against one of our centers, they have no one to discuss it with. That's why we need this agreement between this state department DHS and
Questions? Thank you very much. Roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Beer,
Yes.
James Jennings.
Yes.
We have 4 in favor, 0 against.
4 in favor, 0 against. That motion passed. Next item on the agenda, TR 20-042, a tribal resolution of the Muskogee Creek Nation authorizing the principal chief to execute letters of agreement with Oklahoma State University Institute of Technology, OSUIT, on behalf of the Muskogee Creek Nation Reintegration Program, sponsored Representative Crawford.
Motion for due pass.
Representative Crawford made a motion for due pass. Second. Second by Representative Jennings. Discussion. Representative Marshall. Representative Crawford. Mr. Fish.
Yes. Thank you. This legislation basically allows us to bring OSU Institute of Technology in to facilitate our welding program with the curriculum and structure.
Question, Mr. Fish. Representative Crawford.
How are these people going to be transferred into OSU?
We actually have the welding school on site. So they will be bringing an instructor down to the reintegration program, and we have booths and everything set up really good.
Do you have criteria on the people besides maybe coming out of,
What we'll do is we'll sit down with OSU and our staff, and then we'll screen everybody prior to them being admitted into the program to make sure that welding is a trade and a skill set that they're good at and something that they want to do.
Any other questions for Mr. Fish? Representative Jennings.
So, Mr. Fish, do they have a curriculum also that they take part, say, like they were going to OSU IT, you know, they have to take classroom work also when they take those courses out there.
That is correct. I also have members of OSU here with me who will be instructing and teaching that curriculum, and if I could defer the question over to them.
Thank you. How are you?
Well,
Thank you for being here this afternoon.
thank you for having us. Brad Smith, we do have instructor Keith Baldridge. He will be providing curriculum for the students as well. There will be a lot of class time in addition to the lab time. Oh, and there's also going to be an OSHA 10 card associated with that, and a career path readiness, which will teach the students how to build resumes, do mock interviews, and do different job search techniques.
Thank you.
Representative Jennings. Any other questions for Mr. Fisher? Thank you, Mr. Fisher.
Thank you.
Roll call vote, please.
Mary Crawford,
Yes.
Joyce Beer,
Yes.
James Jones, Anna Marshall.
Yes.
We have 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-043, a trial resolution of the Muskogee Creek Nation authorizing principal chief to execute a room block and banquet agreement with Osage Casino Hotel for the Muskogee Creek Nation Department of Education Teacher Fellowship Project meetings, sponsored by Representative Marshall.
Do pass.
Representative Marshall made the motion for a to pass, second. Second by Representative Crawford. Discussion. Did we not receive an email, I believe, that this is to be postponed? We don't need the rooms, is that correct?
I don't think so.
No.
Sarah Price is here to present on this.
You do need these? Okay.
Yes,
Okay.
yes, sir.
Ms. Price, go ahead.
Sure. This is the teacher fellowship project, 40-plus teachers from about 5 school districts. River Spirit was unavailable during these days, so we have contacted Osage Nation. We also did this last year at Osage Nation because of the repairs being made to River Spirit at the time. So this contract went through last year, but we're just requesting to continue this.
So you don't plan on canceling or postponing?
No, we're set. Okay.
Any other questions, Ms. Price? Hearing none, roll call vote, please.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Beer,
Yes.
James Jones.
Yes.
And we have 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-044, a trial resolution of the Muskogee Creek Nation authorizing the principal chief to execute a certain agreement between the Muskogee Creek Nation and the National Council for Behavioral Health on behalf of the Muskogee Creek Nation Department of Health. Sponsors, Representative Jennings.
Motion for it to pass.
Representative Jennings made a motion for due pass.
Second.
Second by Representative Peer. Discussion. Representative Jennings.
Carried.
Thank you, Mr. Jennings. Thank you, Chairman. Thank you, Mayor. This legislation that's in your packet is for the National Council for Behavioral Health. And the Whole Health Action Management Training is a 2-day training for up to 30 participants. And this training will teach engaging and person-centered planning in whole health resiliency factors to create concise whole health goal, promote new healthy behaviors by implementing an 8-week whole health peer support group, and how to use weekly action plans for success. And I hope you don't ask me a lot of questions about that because I'm not exactly sure what I just said. But it's essentially a software that our behavioral health is going to be working with and train our staff on how to use that in their taking care of our citizens.
Questions? Sure.
So how do you determine which software equipment that you use?
Well, most of these are being paid for out of grant funds, and we rely on our behavioral health director and their staff, and then they typically give us a recommendation, and then they're working with our IT folks to make sure that it's compatible with what, to do that, and then they would take and make that recommendation over to our chief administration officer, and then she would evaluate that from a contractual standpoint and send that to our attorney, and then they would make the recommendation to me. So,
And then you sign off on it?
and and then I sign off on it, so that's typically the process.
Okay.
Thank you, Representative Marshall. Any question, Mr. Chair? Thank you, Mr. Chair. Roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Carver,
Yes.
Joyce Hill.
Yes.
We've got 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-045, a tribal resolution for the Muskogee Creek Nation authorizing principal chief to execute a certain agreement between the Muskogee Creek Nation and HEW USA Inc. on behalf of the Muskogee Creek Nation Department of Health. Sponsor is Representative Jennings.
Motion for due pass.
Representative Jennings, motion for due pass.
Second.
Second by Representative Deere. Discussion. Representative Jennings.
Mr. Chair.
Thank you, Mr. Jennings. This resolution is between the Department of Health and Ag Street, and this is for some new optometry equipment for COIA. So just replacement equipment, and so we're excited to always be able to upgrade. So be happy to answer any questions.
Questions from Mr. Terry? Representative Carter.
How many optometrists do we have?
We have one Okema, Sapulpa, Kalita, Eufaula. I think that's it.
Oh, okay, that's good.
Thank you, Representative Crawford. Any other representative have any questions? Roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Carver,
Yes.
Joyce Hill.
Yes.
We've got 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-046, a tribe resolution of the Muskogee Creek Nation authorizing principal chief to execute an agreement between the Muskogee Creek Nation and Oklahoma State University, Oklahoma City, agreement on behalf of the Muskogee Creek Nation Department of Health. Sponsored Representative Jennings.
Motion for due pass.
Representative Jennings made a motion for a due pass, second by Representative Marshall. Discussion. Representative Jennings.
Mr. Chair.
Thank you, Mr. Jennings. This is for a nursing preceptor student that will be coming to work at the medical center. So we typically pass these agreements from time to time. So anytime we have a new entity that's wanting to preceptor their students, we do these. Be happy to answer any questions.
Questions from Mr. Terry? Amen. Roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Carver,
Yes.
Joyce Hill.
Yes.
And we've got 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-047, a tribe resolution of the Muskogee Creek Nation authorizing principal chief to execute a certain agreement between the Muskogee Creek Nation and ProEd Inc. on behalf of the Muskogee Creek Nation Department of Health. Sponsored James Jennings.
Motion for due pass.
Representative Jennings made a motion for a due pass, second by Representative Deere. Discussion. Representative Jennings.
Thank you, sir. This software specifically is called the Stanford Binet 5 Intelligent Test, and it's the only test suitable for assessing individuals with intellectual disability. This scoring software that's used in the past is not compatible with newer Windows operating systems, and the original developer of that software no longer has rights to the test and won't be upgraded. The ProEd Inc. online system is the only option now available for computer scoring and reporting. So we're asking to make that switch. Be happy to answer any questions.
Questions from Mr. Terry? Hearing none, roll call vote, please.
James Jennings,
Yes.
Anna Marshall,
Yes.
Mary Carver,
Yes.
Joyce Hill.
Yes.
And we've got 4 in favor, 0 against.
4 in favor, 0 against, that motion passed. TR 20-048, a tribal resolution of the Muskogee Creek Nation authorizing principal chief to execute a certain agreement between the Muskogee Creek Nation and MHS Assessments, Inc. on behalf of the Muskogee Creek Nation Department of Health. Sponsored Representative Jennings.
Motion for due pass.
Representative Jennings made a motion for a due pass, second by Representative Deere. Discussion. Representative Jennings.
Thank you, sir. MHS Assessments Inc. is another piece of software that our behavioral health staff will use. It's the most common software that's out there for assessing students between the ages of 6 and 18 for ADHD. And so this will be the tool that our behavioral health staff uses when we're doing those children assessments for that. So we have answered those.
Questions, President Beer?
So we haven't had this before, this is brand new.
As far as I'm aware of, it's brand new.
Thank you, President Beer. Questions? Hearing none, roll call vote, please.
James James,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Beer.
Yes.
Chairman Whitmore, 4 0 against.
4 in favor, 0 against, that motion passed. Thank you, Mr. Turner. NCA 20-010, a law of Minnesota Creek Nation authorizing expenditure of funds received from the Department of Health and Human Services Administration for Community Living for the Minnesota Creek Nation Caregiver Program, sponsored Representative Jennings.
Motion for due pass.
Representative Jennings made a motion for a due pass.
Second.
Second by Representative Marshall. Discussion. Representative Jennings. How are you?
Good, how are you?
Doing well. Thank you for being here this afternoon.
So this is just, we applied for a MENDA grant and we received, it's usually just $1,000 grant, but we received almost $6,000. And what we were going to try to do is over the summer, have 3 separate conferences to help the elders understand the importance of signing up for Medicare and Medicaid, even though they do have free health care through the clinics, but there's other services that we can bill on. So that's basically what that's for.
Questions from Ms. Turner?
Do you have any specific sites that we need to do the conference?
We have been looking at Sepulpa area to cover Sepulpa, Bristow, Old Mulvey, of course, and then we were going to use Holdenville, but we were told they're under construction or remodel, so we're looking at Wetumpka.
Thank you, Representative Marshall. Any other questions from Ms. Turner? Hearing none, roll call vote, please.
James James,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Beer.
Yes.
Chairman Whitmore, 4 0 against.
4 in favor, 0 against, that motion passed. Thank you, Mr. Turner. NCA 20-011, a law of Minnesota Creek Nation authorizing a supplemental appropriation for the Minnesota Creek Nation Elderly Nutrition Program FY 2020 budget, sponsored Representative Jennings.
Motion for due pass.
Representative Jennings made a motion for a due pass. Second by Representative Marshall. Discussion. Representative Jennings.
Mr. Turner.
This is for additional funds for elderly nutrition, and basically it's going to be for food cost. This past year, our grant for elderly nutrition Title VI runs April 1st through March 31st. And then, of course, our tribal funds are September through October through September. We had a decrease in the amount of Title VI funds that we received, and we had an increase in the amount of food purchases, therefore throwing us in a shortfall that we're not able to cover that time lapse. And an increase in participation, so.
Questions from Ms. Turner?
I have a question.
Representative Randolph?
I don't know which one, I think it's Okima. They were saying has a salad bar. Are they gonna be doing that everywhere?
That is our goal. We have 3 sites that now have salad bars. That is Okmulgee, Sapulpa, and, Okmulgee, Sapulpa, Okima, and we just added the 4th, which was Eufaula. And that is our goal, but again, that's cost. It's about $1,500 to set it up and then your weekly cost.
Thank you.
Thank you, Representative Randolph. Any other questions from Ms. Turner? Hearing none, roll call vote, please.
James James,
Yes.
Anna Marshall,
Yes.
Mary Crawford,
Yes.
Joyce Beer.
Yes.
Chairman Whitmore, 4 0 against.
4 in favor, 0 against. That motion passed. NCA 20-011 will be forwarded to BFJ for a funding source. Next item on the agenda, thank you, Mr. Arnold. Next item on the agenda will be other business. We have discussion, Department of Health update, Secretary of Health.
Thank you,
Welcome
Chairman.
back.
Thank you, Chairman. Thank you, committee. You'll have a full report in your packet today. We're gonna go over some of the key items, but I anticipate that everybody's probably gonna want to talk about one thing today, and that's probably going to be coronavirus. And so we'll run through this as quick as we can, and then we'll get into the state of readiness for coronavirus and do that. But on the first paragraph in your report, it says that Governor Stitt announced that the state of Oklahoma will be pursuing new flexibilities through the Healthy Adult Opportunity. Governor unveiled his alternative to the Medicaid expansion state question that voters will decide this year. His proposal would expand Medicaid through a block grant model that sets caps on Medicaid spending for low-income adults in the expansion group. We've had a couple of questions regarding this, and is it good for the tribe, and do we support it or do we not support it? And so I've asked our Chief Administration Officer to kind of give an update on where we're at with this policy and advocacy. So
basically, the CMS, which is Centers of Medicare Services, challenged the state to control costs. In an effort to do that, or all the while of doing this, State Question 802 is on the horizon, where the people signed a petition for the Governor Stitt to put it on the ballot, and many of us have signed that, so that we can expand Medicaid eligibility. And so all the while, Governor Stitt, this is on the horizon, Governor Stitt is looking for an Oklahoma plan of his own without having to expand Medicaid and State Question 802. He said, hold on, I've got my own plan coming, it's coming. So what he did is he went to DC, you might have seen him on TV or in the news, where he was there with Seema Verma, the administrator of CMS, where he announced that I'm willing to participate in this Healthy Adult Opportunity. And what Healthy Adult Opportunity is, basically it's a block grant that gives the states the eligibility to have flexibility in the services that they provide. But also it comes with reporting mechanisms, and it comes with quality indicators to ensure that the program is successful. That's the intent, so that it's attached to some sort of quality indicators. So when you think about a block grant, here's a block, right? And they're going to give you this much money every year, and the state has flexibility to alter what's in it. However, you're not getting any more money. And if you expand Medicaid, then guess what happens? This doesn't expand. This stays the same. So the states have the flexibility to move from here to here to here to here, but you get, so that's where the block grant is every year. So that's their way of controlling costs, is they can foresee and they can budget appropriately. They know that they're going to give the state of Oklahoma this much money every year. And the state of Oklahoma, you can do whatever you want to within this block, but here's reporting mechanisms to show that you're successful. So that's what the Healthy Adult Opportunity is about. With how that affects us is, we have the Indian Healthcare Improvement Act that was passed a few years ago. If you remember, everybody used that same thing to sign. We have to ensure that there are Indian provisions set when they develop this, that co-pays are still, we don't have to pay co-pays. That's how we're able to enroll in these Medicare plans all year long instead of during a certain period. And also work requirements. That's the big thing, is Governor Stitt has already said he wants to institute work requirements within this block grant. So we have to ensure that we are exempt from work requirements. And we have a tribal health group that is working with the state of Oklahoma to make sure that those provisions are set into place. So it's still changing and it's still evolving, because they want to enroll it rather rapidly. I think they wanted to have it in place by July 1st of 2020, which is really fast for the state of Oklahoma or any type of policy change for that matter. So, so it's evolving rapidly. So keep your ear to the ground. I'm sure that next month we'll have more information. And that's how it goes. Does anybody have any questions? I'm trying to talk real fast, so I know it's a lot.
So you had mentioned that there was a person that was working on behalf of us as Native people, or are they just working on
There
behalf
is
of
a
all
tribal
people?
worker. We had asked the state of Oklahoma, because there is a federal law that anytime they have any policy change that is a change to Indian health, they have to have what they call tribal consultation. And so they've already had a couple of tribal consultations. They've had meetings, phone calls, and I have actually sat in on those calls. They had a meeting here at 2 o'clock today, but I'm with you fine people today. But we had sent representation there to bring back the information to us. So it's important that we keep our ear to the ground right now as a health department so that we can, it's an evolving landscape to Medicaid right now that is occurring. So Medicaid as we know it today may look different next year. So it's evolving as we speak. Yes.
Congressman Jennings.
Thank you. Thank you, Speaker. I had visited with Mr. Terry. I attended the legislative forum that was held here in Omaha last Friday, and Senator Roger Thompson reported out on this issue, and then he stated there that it would go to the vote of the people as early as June, so it has to be in place by July. So he also stated that all the hospitals weren't necessarily in favor of this, so that's what I was calling Mr. Terry to find out about folks going. So thank you for that.
I'm sure some of you had heard complaints and issues regarding some of our pharmacy refills that's going on out there right now. As I've reported in the past that we've had new software that we installed getting ready for our new pharmacy refill center in Coweta. That the software, we had about a 75% reduction in efficiency. As soon as it hit, we've been climbing back up ever since. And then about the time that we got there, AT&T started dropping calls from some people that didn't have AT&T phones. If they were using Verizon lines, it was dropping the calls into our pharmacy refill line. So we've started identifying some of these issues, and it's always one issue after the next that we have to identify the issue, call IT, go fix it, and it's never ending. But we're about almost back to normal. I believe it was last week, our pharmacy refill time was about back to about 30 minutes. That's about 25 minutes faster than a Walgreens average. So overall, we're still very, very efficient. But anytime that you have waiting and drugs, we're going to have some issues. But we're about back to getting normal, and I'm happy to answer any specific questions if you have any on pharmacy refill.
Question on refill, but spoke to citizens today that had an issue yesterday at the Okima pharmacy after seeing the doctor. Went over to the pharmacy and said, sit there for over an hour waiting on a prescription. What's the normal wait time? What's the correct way for us to comment on it?
Well, one of the things that they should always do is just walk up to the window and say, I've been sitting out here, can you get up there? So don't be afraid to ask.
That did take place. Citizen was told 30 to 40 minutes. Hour comes by, and back up, still no prescription, so on and so forth.
If you'll send me that name afterwards, I'll be happy to give it. If you want to give it to me afterwards, I'll be happy to follow up with you and check on it.
Thank you.
Contract health services. I'm excited to announce, I've been telling you guys for a long time that we had our new contract health system called Spark. Night before last, we turned on our auto feed into Spark. And so now the referrals, contract health referrals, that the physician writes the referral, it automatically goes into Spark. Spark automatically ranks that 1 through 10. It gets approved. It can be approved right then and there before that patient ever even walks out the door. At Okmulgee today, we were 100% on those referrals. Yesterday at Sapulpa, we were 100%. I think we had maybe an issue at Okima, maybe Eufaula, but we're working through those bugs. But we're extremely excited about this. We're going to do some massive the entry by hand back into the system on some old claims that we have. But I suspect in the next several weeks, the days of having to wait for months for referrals is now over. So we're really excited about that, and just keep our fingers crossed that there's no technical glitches. Public health, I'm going to let you read all of our public health and our nurse case management and what they're doing out in the communities right now. We also, this month, had our American Heart Association Go Red for Native Women event, and I appreciate everyone that attended, Chief, Second Chief, those of you that came, very grateful for that. We had 93 people in attendance, and we were very grateful for that. We went out and provided education to Bacone students and staff regarding the COVID-19 virus this month as well. I'm going to jump in. We did have Dr. Brent Roberts join the Department of Health. He's an optometrist at Okemah, and he previously worked for Cherokee Nation. And for those of you that haven't met Charles Myers, we call him Chuck, he was our Director of Nursing at the Medical Center, and he's now received his nurse practitioner license, and he's a new nurse practitioner at the Okmulgee Clinic doing urgent care right now. And the comments that I've received is he's too nice to work here. And so you need to go see him while he's still being really nice. So we'll get into the finances just a little bit. You'll see that we had a really good month in third-party collections last month. We were at $6.3 million. Our goal every month right now is $6.2 million for what we budgeted last year. So we had a really, really good month. I'm going to let you guys look through your graphs. If I was you and I had a concern about these graphs, the thing that would draw my attention is if you look, you're going to probably see labor costs going way up. And you're going to say, well, Mr. Perry, why is your labor cost skyrocketing like that? If it keeps going up like that, you're going to be broke. But we think that these labor costs are tied to, we still have to pay our employees on those holidays, and we still have to have people here. So we're paying double time, and of that, on the good news with that is that our visits also went up incrementally with our staffing, so we should have revenue that also offsets that. In gross revenue for January of 2020, we had a 13% increase of where we were at in January of 2019. So we had 4.4 million in gross revenue, and we had 3.1 in net revenue, and that's a 28% increase of where we were at over this time last year. So just as a reminder for those of you that don't speak this language every day, gross revenue is when we take our charges and then we compare that to how much cash we brought in. So when I say gross revenue, that's how much we charge people. Net revenue is how much cash we actually brought in. So our actual cash was up 28%, 3.1 million last month. Expenses was up 6%, almost $800,000 over last year. So that resulted in a net increase of 1.4 million in operating efficiency over where we were at last year. Admissions to the hospitals are up 11%. ER visits are up 13%. Outpatient visits are up 26%. In the hospitals, in the clinics, we had a gross revenue of $7 million. That's a 20% increase over this time last year. Net revenue was up about $1.8 million. Our expenses over last year's up about 20%, And so that's about a $2.5 million increase in clinic expense over last year. However, I will say that we had gotten very, very conservative last year, and we were able to, the more money in third party that we grow out of our third party revenue, we're able to pump back into these clinics and grow our clinic services. And IHS, also, we had a good year this year in IHS expense. There was additional, 5% in IHS funding for this year. So we look very good there. Total clinic kept appointments, we increased our efficiency by 11% in kept appointments. We had over 4,237 kept appointments last month. And cash collections in January and February were back up with 6.3 and 6.2 million. So that was well where our average should be. And with that, that will be my report, except for the tribal readiness for coronavirus. So I'll be happy to answer any financial questions if you want to talk about finances.
Questions from anyone on the virus?
I had a couple of citizens ask why they weren't notified on their cancellation of their appointments. They traveled to the clinics and they were told that their physician that they were down to see was not in today, and that they asked, well, could they see the other one? They said, no, they're booked up. And they wanted to know why they weren't called to be told this information.
They should have been. So I won't make an excuse because they should have been.
Right.
So I'll be happy to check into it. If you'd like to give me some names later afterwards, I'll be happy to take them and we can call and look specifically into theirs. We have those administrators call and check on that. I can think of 5 reasons how it could happen, but I won't go through the list of excuses today. But I'll be happy to check.
Any other Representative Jason?
So how about the employee clinic? How's it going, Mr. Terry?
It's going fantastic.
Good.
We have gotten lots of positive comments about the employee clinic. People really like Tracy, our nurse practitioner inside there. Her customer service, her patient satisfaction is really off the charts. And she gets you in, she gets you out. We've moved Amanda Wyatt from our Coweta clinic, who's our diabetic nurse case manager. She's now starting to be assigned all of the diabetics that come into the employee clinic. And we're going to be starting to manage these high-cost patients, employees, that's really going to benefit our self-insured employee benefit plan. So we're gathering that data up. So I've really been very pleased on the efficiency of that clinic. The employees have given all great feedback. One of the things that we're going to do today in response to this coronavirus is I've asked now to put our first telemedicine camera inside the employee clinic, and we're ordering telemedicine cameras for all of our other facilities. And so I'm hoping in the very near future we're now going to have an option for our patients that can sit at home and they can have a telemedicine visit with our clinics and not have to come into the facilities. So we think that we'll be able to turn that on quickly. We bought this license for behavioral health. Our psychiatrist, Dr. Pauls, was driving one day a week down to Eufaula Dorm to see patients down there. And there were days where he would only have 2 or 3 kids. and then he would have to come back. Well, that's 2 hours of road time for a physician that cost us a lot of money. So we worked out this telemedicine deal, but we think that's going to be a really nice pickup for that. So we're really happy with the employee clinic, and thank you for asking that.
I have another question. It's a follow-up from last month's comments on the Medicare Part B. You're gonna start that to pay for all those that don't have Part B, correct?
We are. I think that we're probably 60 to 90 days away. We still have some assessments to go through, but I would suspect that's our time frame.
Yeah, that's a pretty, I think, you know, we have the opportunity to do travel sponsorship. The Indian Healthcare Improvement Act allows us to do travel sponsorship. I know from a policy level and on a national level, we are working with Medicare and Social Security because it can't, the premiums cannot, has to be taken from their Social Security check. There's no mechanism nationwide for us to be able to pay them directly. And so we're looking at maybe that being a reimbursement program so that we can get that. And so there's some, just some things that we're going to have to tie up on that piece of it. But on a national level, we are working with Social Security so that that's something we can get into, that we're able to sponsor, and it will, I mean,
Thank you. Thank you. Any questions? Speaker?
Thanks. Mr. Terry, just a couple of issues brought to my attention from the OKEMA. One, again, is the, when the patient, after the patient sees the doctor, they go to the pharmacist to wait on their meds. I've been informed they're waiting over 2 hours for their medicines to be filled. Of course, I explained to them the software, but it's getting to a point now where even that answer is not sufficient enough. They want to know why is it taking so long? Why is the software not?
I'll check specifically on OKEMA when we get back. This is what we've heard a couple of times in the last 2 days, that seems to have gotten worse. So I'll check on that and I'll report.
Then the other issue was, why did they remove all the masks from the hospital?
I'm going to talk about that.
Because again, they're sitting in the lobby area and everybody's coughing and sneezing and.
There's a very good explanation,
Okay.
and I'm going to talk about it
Okay.
with the coronavirus. So, okay, so about a month ago, this coronavirus, or COVID-19 virus, was brought to our attention. It was happening in Wuhan, China, and it was the thing that was going to affect the Department of Health was that it was causing a world shortage of surgical masks. And that we knew that we weren't going to be able to get the amount of masks needed for us to do our job. We would have to start canceling surgeries. We were going to have not have these masks available. So what happened, because the elevation of fear happened, lots of clinics went in and started ordering lots of masks. Well, when the distributors of these personal protection equipment, and it became a national shortage, they said, okay, well, Muskogee Creek Nation, we can see your order last year, and you only ordered 2,000 a month, but now you're ordering 5,000 a month, and we're going to restrict you only back to that 2,000. Well, guess why it went to 5,000? Because one nurse in Okema or Okmulgee or somebody got scared and went out and ordered 3,000, and they hurt the whole system. So that masks, at the end of the day, the plain surgical mask, there's two types of masks. You got the one mask that you see people wearing every day, those surgical masks, and then you have a second mask that's called the N95. N95. The N95 mask is the mask that has the ability to block microscopic bacteria from coming in. The regular surgical mask that you had out in the clinic does absolutely nothing to stop the virus from coming in. The only thing that those masks really do is if I have a mask on and I sneeze, my sneeze doesn't hit her. So that's what those masks were for. But what we were really terrified and scared of was that our emergency crews, our emergency room doctors, and our surgical teams weren't going to, and our patients weren't going to have the mask inside those areas. So that's why we had to pull all the masks from all the facilities, and we centralized them in Okmulgee. And so now we ask them, once they need these masks, then we distribute them out from Okmulgee. So we had to pull them and centralize them because we were being deemed as a whole system. That was the very first thing that brought the COVID-19 to our attention. Shortly after that, the COVID-19 virus started in Italy, started spreading throughout the rest of the world. We started hearing about the first cases up in Seattle. I got into a nursing home, and the first, I think, 19 folks in the United States had contracted this virus, and in the nursing home we had our first death. So we spend the vast majority of our day today, one, tracking what is actually happening, and also tracking what a lot of people are speculating out there. And there's lots and lots of people saying lots and lots of things. And we have been really trying to be diligent in how we are putting out those facts. So the first thing that we did is we put together our internal task force inside of the Department of Health. So every single day, we have a group made up of our infection control, our safety manager, our quality folks, our chief medical officers, chief administration officer. I think that's about it. And they meet every day and say, here's where things are at. Here's where they stand. We're tracking it here, we're tracking it there. And then they start making recommendations. Do we need to be, do we need to start doing anything differently? The first thing that we really did is went in and started focusing on the cleanliness of all of our facilities and making sure that all of our cleaning protocols were in place. So Sam Ketcher, we actually brought some hand sanitizer over for you guys today. And so we know that that's hard to get out there right now. And so we want you guys to be safe. So, so we really focused in on our cleaning procedures. We started going through scenarios inside of our hospitals about what happens if a person walks in. What are you going to do? Who are you going to call? And what's the procedure? So we've gone through all of those scenarios, and I say with 100% confidence that if a patient walks into one of our facilities, we're 100% prepared to deal with this virus situation. After that, about a week and a half ago, we gave an update on Monday morning at the cabinet meeting, and Chief Hill asked to formulate a task force for the entire nation to check the readiness of the entire nation. So on, I guess the date was Tuesday, we had our first nation task force. We invited the cabinet level people from the nation. We invited all of the various entities, from the casinos to the college to business enterprises. If we thought that there was an entity out there, we invited them in. And we gave them a status and update on the coronavirus. We gave them a status update on the proper protocols. If someone was to walk into your area, how to clean your area, what to do in case this happens. So we did this for the entire nation administrative staff. So we have started now identifying weaknesses on where the nation may be weak at cleaning some areas and not cleaning some areas, and we're going to be making those recommendations to the principal chief, and we're going to start having these task force meetings on a regular basis. Now, we did our first draft of what is going to be a daily update to the principal chief. We've put that into 3 separate categories. We're having leadership, what to do if you're leadership, what to do if you're a patient, and what to do if you're a employee. So we're going to be breaking down into those 3 areas, so our citizens, our employees, and our leadership knows what to do. And we're going to be making those recommendations for the principal chief on a daily basis or as often as we need to. One of those recommendations that came out today was that we have made the recommendation to stop all, that travel is going to be restricted to essential travel only. And so we already had a few employees throughout the nation that was going to be traveling today. So what the memo is essentially going to say is that if you are asking for a travel exemption, that you work with your cabinet person, then that's going to go to Mr. Anderson, and they will get a concurrence from the principal chief's office. So as of today, that was that executive directive came out today. With that, we think that's kind of the status of how this virus is tracking. Just for your own information, it does, we don't know how severe this is going to get. I explained that where we're at today with this virus is if you have a house fire, you don't wait until you have a house fire to go out and buy a fire truck. And I think that's where we feel like that we could be at today if we don't get ready, that we will have a fire here and not have a fire truck. And to be responsible, we want to be ready. So we've made recommendations that has gone out to employees about the very first thing you can do is thoroughly wash your hands. Avoid, what's your social words that you use? Social distancing. And just not trying to spread sneezing and coughing and touching and restricting that as much as you can. So there's no treatment for the COVID-19. The only time that we're going to be treating you in a facility is if you go into respiratory distress and we have to treat the actual respiratory distress. But unlike the flu virus, you can't be tested on the spot and be swabbed. We had one person that needed to be checked, and it's at least 72 hours for us to send that off right now. So we're encouraging citizens to call us if they need, and we can question and assess them over the phone, or they can walk in, either way. So we would rather, right now, we would rather them call, but we're prepared. I guess there's no medications that we can give out, unlike the flu, where we can give Tamiflu out. There's not an antiviral to get in front of this thing. You've heard a lot of people say that, well, this is affecting more elderly than it does kids. It's a little bit of a dangerous statement because kids are still carrying this virus. And even though the deadlier, more severe symptoms are happening in older adults, kids can still be carriers. And so just be very careful with that. And right now, we're also assessing, because we know that our elders is our tribe's treasure, and the ones we want to protect the most. We're also going to be assessing what is the impact at our elder lunches and these elder meetings. And when we feel like that we need to make a recommendation to the principal chief that we need to protect those, we'll be making those recommendations as well, but we are assessing that daily. I think that's about the extent of where we're at today. If you guys can think of anything that I left off.
The only thing I wanted to add to was there are 2 positive cases in Tulsa County. It hasn't spread anywhere else. That was this morning. One of them is confirmed case, meaning that their test came back and they were positive. And the other one is a presumptive, meaning we hadn't got their test back, but we think that they are. Both of them are travel related. It is not community spread yet. Dr. Fauci, I think, who's on the President's Task Force, announced last night that even though states are only seeing travel related right now, that it is coming and it will be community spread at some point. So it's not a matter of what, it's when. Sean indicated some of the high risks that we are looking at are elderly patients and patients who have chronic conditions such as diabetes or COPD. Those would be chronic condition patients who would be affected by it the most. Some of the recommendations that the President's Task Force has offered is for the elders to have social distancing, anybody over the age 60 to not go even to church, to stay away from basically where there are large group gatherings of people. As Sean indicated, there's no vaccine. Currently, it's just in Tulsa County. We are closely monitoring CDC protocol and guidelines. We have people that are watching that daily. And just as soon as we put one form on, chances maybe tomorrow that form is gone. That's how quickly and rapidly this is changing. And so we are staying on top of this. I want to assure everybody that we are staying on top of this. The CDC guidelines, we are very pleased that our staff is very responsive and that they are prepared. This morning, they practiced a tabletop exercise where if and what, and I think it's kind of like, in my mind, I picture like a Dungeons and Dragons, not to be gloom and doom about it, but it's like it's a board game where they come in. If this happens, what are you going to do? If that happens, what is you going to do? They are prepared, and we received great responses about their preparedness this morning. We are meeting on this daily. I would say 90% of our day has been focused on coronavirus. We have issued press releases. We are trying to stay in communication with citizens. And so we've done PSAs. You may have seen Dr. Bark and Dr. Beats on social media. We're trying to keep everybody as informed as we possibly can, because if they're informed, and we hope that when you go to community meetings, that you'll take this back to them, because we're gonna need everybody's help to educate. We have a very small staff of infection control people, and so we can't get them out to all 88,000 citizens, so we're trying to look at ways that we can most effectively reach people. The last thing that I wanted to talk about is what are the symptoms? Fever, cough, and shortness of breath. They'll also ask you, have you traveled anywhere? So if you present and say, I have fever, cough, and shortness of breath, well, have you traveled anywhere, or have you been exposed to somebody who has COVID-19? And we have signs on all of our facilities that say, if you present with these symptoms, and you traveled abroad, or you traveled, been exposed, then please notify somebody immediately. I would like to not to digress, but CDC also recommends that these face masks. You see people on the airlines with face masks, CDC recommends that they're not for people who are well. It is not, that is unnecessary.
Some of the comments that we had heard early on in our response, we've been posting the status of our readiness on the Department of Health's Facebook site. And so I think a lot of folks that when they want to know what's going on at the tribe, they go to the tribe's main website to get updates, or they go to the tribe's Facebook site. So yesterday, as part of our task force, we now have started linking all of the updates that we have coming out in the Department of Health will be put on all of the sites. So we hope that that does a better job of informing the public. So the Chairman, I'd be happy to answer any questions.
Questions from Mr. Chair?
So do you think it's necessary or for safety precaution for our communities to maybe cancel any activities or events they may have scheduled there? I mean, like our community in Muskogee, they usually have like 65 to 70 on a community night before meeting, and it gets kind of congested in there.
My personal opinion right now is that I think better safe than sorry. I think we're at the very beginning of this virus, and you don't know if one of those people's been infected, and it's just going to take one that walks into that community meeting and they go and touch food and they go and touch all of that stuff and shake hands with everybody, and you've infected everybody in Muskogee that's at that Muskogee meeting. So that's my personal opinion. That's not the official opinion of the tribe yet. Whenever that official opinion gets there, we will put that to the principal chief, and he will have an executive order that says we're advising you to now cancel meetings.
We did make the decision to cancel the addictions conference that was going to be held at the end of the month in Riversphere. We did that to minimize exposure, because that's what we're ultimately what we're trying to do. In consideration for Tulsa is that Tulsa now has two confirmed, well, one confirmed, one presumptive case in Tulsa County. So in theory, that's, well, in reality, that's a hot spot. Tulsa County is a hot spot. And so for us to go ahead and have an addictions conference there, where we have over 500 attendees there, and there's in River Spirit, in our own casino, what if somebody got COVID virus? We had to decide that. So we're trying to minimize exposure, and we don't want them to contract it at River Spirit, because then what's that going to do to the nation and our revenue?
I will apologize to the National Council. I did have an email update for you guys that I tried to send to the speaker, and I couldn't get it to go through my email system, so I apologize for that. So, but hopefully we plan to keep you in the loop with everyone else with these email updates, and we hope that these daily briefings, as we need to do, and
feel bad and they feel like this is it, do I need to get tested, where do they go?
First thing I would do is call. So you can call any of our facilities and say, I feel like that I may have this. And they'll be connected to someone, and they'll be asked a series of questions, and then they'll be instructed what to do. If they just know that they feel bad and that they're having actual problems, go to the facilities and walk in and say, I think I have this, and the staff will put a mask on them, and they'll put them into a room that has negative pressure, and so that that air is not recirculated throughout the building. We have negative pressure rooms in all of our facilities, with the exception of the Tunco and the medical center. And right now, we have about a $6,000 purchase for a portable negative pressure room that we're looking at right now. And so we do have a negative pressure room at the, if we need to use that. But first thing to do, tell them to call. If it's after hours, they can go to the emergency room that they need.
Thank you.
Any other questions? Thank you very much, Mr. Terry. Mr. Crawford, thank you all for your report. Appreciate it. Next item on the agenda will be announcements. Do you have any announcements from council?
I would like to introduce Sam Kessler. Sam is over at our EBS, our facilities cleaning supplies. We brought some supplies over for National Council. If you want to tell them what you brought over?
Symmetry hand sanitizer that we have throughout all of our facilities. A couple years ago, we standardized throughout all Creek Nation health facilities. So we have hand sanitizer dispensers and the actual product to go into them. CDC recommendations for hand sanitizer is it has to have at least 60% alcohol content. So you may want to tell some of your citizens, make sure their hand sanitizer has that capability. So I believe, are we going to install these here?
I will allow you to work that out, to where y'all would like to have installed that, or what you would like to do, but we have them here.
Thank you all very much.
And one more thing. I know this is kind of an awkward conversation to have, but we also discourage handshaking. I know that's discouraging and it's awkward. I was talking to Representative McHenry back here to come in and not be able to shake hands was kind of awkward, but we also asked them to minimize the touch and shaking hands. So I know that's going to be awkward for everybody, but it's a suggestion.
Thank you. Thank you again for bringing hand sanitizer.
Thank you.
Any announcements from council? Chief, say what's the announcements. Any motion to adjourn? President Jennings made a motion to adjourn. Second by Representative Marshall. All in favor say aye. Aye. All opposed, same sign. I'd like to ask Representative Jennings to please give the amendment.